Thank you for joining us for this segment of the Mental Health Series presented by Entelios, which includes the American Registry for Diagnostic Medical Sonography, ARDMS, the Alliance for Physician Certification and Advancement, APCA, and the Point-of-Care Ultrasound Certification Academy. Your mental health is just as important as your physical health, and even more so when you are in the middle of a crisis, dealing with new challenges and uncertainty. The well-being of our healthcare professionals is critically important to us, which is why we created this mental health series. We want to help take care of you so that you can take care of your patients, your friends, and loved ones.
Hello and welcome to today's podcast, which is part of a mental health series brought to you by Entelios and its family of certification councils. This podcast is in collaboration with the Moral Injury of Healthcare. I'm your host, Tricia Turner, current chair of the ARDMS Council and director of the Diagnostic Medical Sonography program at South Hill School of Business and Technology in Pennsylvania. Joining me today again is our guest speaker, Wendy Dean, who is president, CEO, and co-founder of the Moral Injury of Healthcare, a nonprofit organization addressing the crisis of clinician distress. During our last podcast, Dr. Dean spoke with us about how the pandemic has impacted healthcare professionals' distress and what challenges they are facing. We're going to continue that conversation today. Wendy, thank you again for being with us today.
Thanks, Trish. It's really my pleasure to be here.
Well, in the first part of the series, you talked about the challenges facing clinicians, the litany of unknowns with the virus, the anxiety of protecting themselves and their families, the lack of preparedness, and the limitations of supplies and staff. How can organizations address some of these challenges and clinicians' response to them?
I think one of the biggest challenges that healthcare organizations face in the middle of a surge is understanding how to support their staff. And a lot of what happens is that organizations will set up mental health support services where people can come in, they can take a break, they can talk to providers, or they set up opportunities for folks to meet together as groups. But in fact, what I'm hearing is that a lot of them are getting frustrated by the fact that they set up these support systems and people aren't coming to use them. And in fact, that's not unexpected. Typically in the intensity of the initial surge or a big hotspot surge in the pandemic is that people who are in the middle of 18-hour workdays or 14-hour workdays don't have the energy or the bandwidth to be able to stop and process the psychological impact. And what they really need is support with their basic needs. That they can pick up groceries in the lobby when they leave, that they're getting fed when they're on shift, that they're getting transportation if they need it. And if they have very vulnerable family members at home, that there are alternative options for them for living arrangements so that they don't have to worry about bringing the virus home to their families. And so all of these responses sometimes feel like they're not doing enough to support clinicians' mental health, but in fact they're exactly what clinicians need. Is they need their basic survival needs taken care of, because they won't start processing the midst of the challenges that they're in probably until they have a minute to breathe.
Yes, and when you're responsible for everything outside of the workplace, it's hard to find that time to breathe. And doesn't that just makes so much sense, the basic needs. If I have to worry about where food's coming from, or if I have to worry about where I'm going to sleep tonight because I'm trying to keep my family safe, those can override some of your work thoughts, if you will, or just add more stress to you during the day. Makes so much sense.
Absolutely. And in the midst of a surge, staff is very tight. Mm-hmm. And so we need everybody to be free to do their jobs to the best of their abilities, which means freeing them from all those other worries, taking care of their families because it's taking good care of our staff as well.
Absolutely. Makes so much sense. What are the trajectory and the timeline for support and recovery?
Well, as I said, when you're in the midst of that wave of pandemic transmission and increased patient volume, you don't really have the time to process what's happening and the actions that you're taking and the impact that they have on you. You're just doing the next thing in front of you. And when people are really starting to recognize that they might need to talk to someone, they might need to process what they've seen and what they felt, is when the surge has subsided somewhat and they have time to take a breath and they have a little bit of distance on what that intensity was. It may be a couple of months down the line, it may be 6 months down the line. And what we've seen from previous incidents, natural disaster crises, school shootings, is that the need for psychological recovery is very long. And it may extend as long as 2 or 3 years after the incident has resolved. So given the fact that we're likely to be in the midst of the pandemic for a long time, we may be seeing the need for psychological recovery support for as much as the next 3 or 4 years.
As we look forward, and even during this time, obviously there's a lot of levels of management. And our listeners that are out there probably cover a wide range of management levels. And do you have any suggestions for them on what they can do at their level to help their staff? And we don't have to get into the specific levels, but if you find yourself that you're a manager of a department and you have several sonographers or rad techs working for you underneath and you're in charge, what can they do to help their staff, or what can we do for each other in this time?
That is such a great question because there are so many things that people can do. There are very simple things. What we have found from several different groups is that even very informal supports, such as private message groups that have either common interests or are a common license group or are one department, if you can give people a safe place where they can blow off a little bit of steam, but support each other in a respectful way, that can go a long way. Daily check-ins. How's everybody doing today? Kind of taking the temperature of the group. And for managers, asking, what do you need to be successful today? And the answers may vary. It may vary widely. I need groceries in my fridge.
Mm-hmm.
I just need to be able to check in and make sure that my kid, my 14-year-old who's at home by themselves, is okay. So I'm going to need a break in 2 hours.
Mm-hmm.
Yesterday when I was here, we didn't have this particular supply on hand. Help me find that for today so that I don't have that same struggle again. So those sorts of things are really helpful, and they make people feel supported. The other thing that I think management and leadership can be thinking about is that long horizon of support that's needed may require looking outside of the system itself to provide that support. And so starting to think about, how do you develop memoranda of understanding with some of the organizations in the community that can provide those services? How do you bring in, maybe you need to bring in a third party that can help support your folks in doing the psychological recovery, especially if trust between your clinicians and your organization has been fragile. That can be very helpful.
I can definitely see how that would be, for sure. Now, as let's just say, for lack of a better term, the low man on the totem pole, right? And they're really feeling overwhelmed with all that's been happening. I mean, brand new graduates are coming out and they're being thrust into this unknown that nobody has ever experienced before. How can they approach a manager, or what would your recommendations be for that person who isn't a manager, but again, kind of the low man on a totem pole? What can they do to help their department and themselves?
One of the really critical things at this point is to make sure that folks who are coming out brand new have support, and partnering them with somebody who's more experienced. Having a buddy system, in fact, is a really great idea, so that they know they have one person that they can go to and say, here's my struggle. How do I approach this? I'm at a bit of a loss, or I'm having this challenge. Here's what I think is an appropriate response to it. What do you think? And I also think that it's really important for even brand new grads to know that you bring something valuable to this challenge. You're bringing your youth, your energy, your optimism, and your commitment, which is really important. And I would hope that the organization would see that and appreciate it for what it is.
Absolutely. And you are so right. Our brand new grads who are out there, regardless of what aspect of healthcare they work in, they do bring such energy and new ways of thinking that we definitely, as old timers, for a lack of a better term at the moment, can really turn to and feed off of that energy and their new approaches. And that definitely could be supportive in this time for sure.
One of the things that I think is that when people are giving you feedback, they really care about your organization. I worry more when they stop giving feedback, because that means that they've detached. So the more feedback, the more engaged your workforce is, which is great.
Yeah. And that's such a simple lesson. Back when you were young, you learned that if your coach is paying attention to you and they're giving you feedback, they care about you. The moment they don't say anything is they gave up on you. And that's an old lesson from when you were young. So I love how you tie it all into our professional lives and what we can be doing with our colleagues and our peers. Just fantastic. So thank you. So what if there is a second wave? I mean, I don't necessarily know that we've lived through the first, but what do you foresee happening if there is a second wave that hits us again?
I think if there's a second wave, there are two things to think about. The first is all of us are wondering the same thing and feeling the same way. We're not really done with the first one. How can we have a second one? And so what that means for folks who know they may need to re-engage and to put that armor back on to go into the fight again, if numbers start to escalate, is that they may be very hesitant to start addressing some of the mental health issues, or to really start doing the work of psychological recovery, because that work is hard and it can make you less functional temporarily. So it's going to be much harder to armor up and go back into the fight if you're in the midst of processing what you saw the last time. So I guess it's a way for me to notice for leadership that if your folks aren't really enthusiastic about doing the work of psychological recovery and engaging in the support services that you've put in place, there may be a reason behind it, which is that they're afraid to do it.
Yeah, and if we have to face it again, you know what you experienced the first time, and you obviously not looking forward to the second time around. And if we don't have those support services there, what do you think would happen, or how do you see the implications of not providing that support? What could happen if we don't handle the first wave, so to speak?
Right. So I think there are two things to think about in that. The first is, if there is a second wave, or if there's a resurgence in a first wave that never really completely ebbed, there are lessons learned. And so taking every one of those lessons learned and applying it to the resurgence will be critical. For example, bringing groceries to the lobby, right? The implication for not hearing those lessons learned and not applying them, really, I think the biggest challenge will be keeping people in healthcare, because we're already in the setting of shortage. Both nurses and physicians are facing a shortage, and I'm sure that with the increased need for all licenses, sonographers are also in short supply. And so if we don't find a way to support folks through this intense challenge, something we have never seen in our lifetimes, people may well do the calculation that the risk is not worth it. And they may find all of our clinicians are incredibly skilled people, and they will be able to translate their skills into other jobs. And I don't know about you, but I sure want good people
Yes.
to stay in medicine, right? We need them. And so valuing the skills that people bring and the passion, the compassion that people bring to their jobs every day is critical going forward.
Absolutely. And as you were saying that, that's the one thing that I was thinking about is the experienced clinician, the experienced sonographer, the experienced nurse. And we love our new grads for their energy and their new ideas, but nothing really replaces experience in the medical world. You can read all the books you want. I talk to my students about this, but until you get into the clinic and are working and applying that knowledge, there's nothing that substitutes that experience. And when you're talking about losing, or the possibility of losing, our medical professionals, which would most likely be our experienced ones, that is just, I couldn't agree with you more. That is not something that I want to see. We need our experienced, our knowledgeable clinicians out there to help bring up the new grads and help them with their experience and knowledge.
Right.
So that would be a big concern. Yep.
Right. Exactly.
So is there anything else? We're close to the conclusion of this second part. Is there anything else that you would like to share with our listeners? Anything you would like to add?
I think the ARDMS has done a really great job at compiling a clearinghouse of information on the website. So I would encourage people who are looking for information to go there. And I'll also offer a few resources that folks can go to the website and look for if they're feeling like they need additional information, either about COVID or about psychological support resources that are available.
That's fantastic. And I know our listeners will really appreciate the resources that they can share, not only with their peers and colleagues, but also their administrators. So that's fantastic. Thank you. Well, that concludes our two-part podcast series with Dr. Wendy Dean of the Moral Injury of Healthcare. Wendy, again, thank you so much for sharing your insights with us. This is definitely a challenging time for so many of us out in the medical field, and we really appreciate your perspectives on the support needed for healthcare practitioners' recovery.
Thank you so much.
Thank you for participating in this mental health series brought to you by Intelios and its family of certification councils. You will find additional resources at ARDMS.org, APCA.org, and POCUS.org. These resources are for informational purposes only and should not be used as a substitute for professional medical advice. We encourage you to reach out to your personal physician or medical provider if you have concerns or questions.